what are 3 practical tips that you can give them to empower them to discover their health risks through genetic testing?
Okay, first of all, cancer is scary. It's something that, kind of can terrify people. One thing to know is that treatments of many types of cancer have increased dramatically. Survival rates have increased dramatically. So if you find out that you have cancer, and especially if you've kind of managed to find out it's an early stage, don't lose hope. There is hope. Kind of see your doctor, see an oncologist, look at the options, but don't hesitate. Kind of move quickly. Don't say, "Oh, I'll kind of put that off," or kind of move quickly, because the earlier that you get treated, the better it's going to be. There are many more targeted medicines that can be helpful. Kind of second, kind of if you do know that you have a genetic mutation, just know that the risks are higher and you want to get screened. Kind of we've got mammographies for women. Most women get it, but if you have the BRCA gene that causes breast cancer, make sure that you're getting tested more frequently. Kind of ask your doctor what kind of treatment that you might get as well. So kind of you can take control, kind of with the help of your physician, of your own healthcare. You don't have to sit back and wait. And I think kind of, one of the things my mother lamented, and I remember, kind of that she was kind of concerned, kind of something was going on here more. And the doctor was saying, "Oh, you're kind of over worried." Don't accept that for an answer. If you're not getting kind of the treatment that you want, kind of look for another physician, kind of talk about your options. And that's really, really important. So I think those are the two of the main things. And then, kind of there's a community of people out there who can help you kind of with resources. So, for example, on Facebook, there are groups for Li-Fraumeni Syndrome families. And there's kind of a wonderful, kind of sense of community and advice that people can go to for communities like that. So, for example, kind of whether it's, advice on testing, advice on, kind of, I live in the city, who are some of the good doctors, who are some of the good oncologists, even some of the social, psychosocial aspects of it, because I've seen kind of great discussions about young people saying, when should I, kind of maybe they're in their 20s. I've got this genetic mutation. I'm dating somebody. When should I let them know that I have this mutation? Kind of just how to deal with that. I mean, I think that kind of reach out to all the potential sources that can help you.